Fish out a pen here. Okay, all ready? Good afternoon. Good news today. Washington State continues to lead in bending the COVID pandemic curve downward. It continues to lead in saving lives, and today's announcement will continue in that vein. I'm really happy to say all 8 regions in our state are currently in phase 2 of our reopening plan. And today I'm announcing a pause on any possibility that a region would go backwards. And we're making this pause in recognition of the fact that we've made incredible progress in knocking down the infection rate of COVID in the last several weeks. Now, we know we need to follow the science and the data in making these decisions, but I think it is clear that we have had enough success in the recent weeks to be able to put a pause on any alternative that regions would go backwards. So that's what we are doing today. I'm happy to do that. During this weeks-long pause, we will evaluate the situation and work with our public health partners and stakeholders on how to continue going forward. So why are we doing this? Well, during the 3rd wave of the COVID-19 pandemic, our rolling average for new daily COVID cases was approaching 3,000 per day. That has come down dramatically. As the approaching graph, if I can put this chart up real quickly, we can look at this chart, and we'll notice that we've had sort of 3 waves in Washington State. The most recent high numbers were in the 3,000 per day. You see they've come down dramatically in the last couple of months. Now they're in the range below 1,000 per day. So this has been a very significant reduction in cases in our state. And I want to credit Washingtonians for what everybody's been doing. Wearing masks and being safe is the reason we're knocking these numbers down. We acted, and the reason we acted is because our state was struggling under those very high numbers. And given that unprecedented level that we had in December, we had to design our reopening plan so that it was very sensitive to the potential that COVID would come springing back. But under our current data trends and the progress we've made to knock down this 3rd wave, they've told us that we don't need this really hair trigger circuit breaker, if you will. And so I'm really happy about being able to announce this today. Now, we know that despite this good news, we need to remain very cautious. We're able to do more activities today. We know that over 1 million Washingtonians have now had the vaccination. We are finding an increase in circumstances, the ability to return safely of our children to school, to on-site education. I want to thank educators for their really hard work they're doing in collaboration that it takes to be able to do this with everybody in the community. So this is promising news for millions who are now ready to get back towards a life that we know before the pandemic swamped us. But we cannot let our guard down when we are so close to a potential victory. We have to continue to follow the science, continue to do the things that we know that work: face covering, distancing, and good basic hygiene. Now, we also have to remember, I know people are aware of this, of the variants that are now in our state. We have confirmed the presence of several variants in our state, some of which have increased possibility of transmission. So we need to be mindful working with our health scientists going forward. We ought to be both confident and cautious at the same time. And if we do that, we can look forward to better days ahead. So obviously there's a question of when we could move our state forward through another phase. It's a good question, and right now we will be answering that question in the next several weeks as we listen to people in the community, as we listen to local elected officials, local health, public health issues, workers and businesses, and particularly as we look at the development of the science around these variants. It's very intriguing that every single day we're getting more information about these variants, and importantly, the ability of our vaccines to prevent transmission and, importantly, ultimately to prevent hospitalization and deaths. There's some good news on this, that in the last several days, internationally, we have received increasing scientific information that the vaccines are effective to prevent hospitalization and deaths, even against these variants. But we need to continue to monitor that science in the upcoming weeks. So the science is coming in, and now we've had major progress on our vaccination effort. For the first time the other day, we did over 45,000 vaccinations in one day, which was essentially our goal. We wanted to demonstrate capacity to do 45,000 vaccinations a day. We have met that goal. Now we need the dosages to continue to come in to be able to do these vaccinations. As these doses continue to increase, we think we will increase an average fairly rapidly to that goal. And now we're also on the verge, as you know, of having another vaccine approved, the Johnson & Johnson vaccine. There's a possibility it could be available as early the following week. So there is plenty to be excited about the ability to get vaccinations. And we know people are both eager and frustrated because we still don't have 5 million vaccines available tomorrow morning. But the numbers are really improving. And ultimately, our decision about phases will follow our continuing progress in this regard. I want to thank the Biden administration for some of their work, too. We're pleased that the administration continues to increase our supply. Last week, the Biden administration allocation to the states increased by 13.5%. They now have had a 57% increase since the administration took office. That's really rapid progress. This will increase by another 1 million doses for all states, tribes, and territories this week, pushing the total weekly allocation nationally to 14.5 million doses. So 1,000 more Washingtonians are getting vaccinated every day, and we have capacity today to do many times more than the doses we're actually getting today. So we need this supply to catch up, but it is coming up. I also want to thank President Biden for canceling the so-called anarchist cities measure. The last decision in September really was a brazen election year politics. That's all it was, and it's good to get that in our rearview mirror. We are continuing to work some of the issues we have to make sure this program is efficient as possible. We've had some concerns of a county or two about the amount of Pfizer vaccine they're getting. I'm told our Department of Health is working with local health departments and providers in these counties to be able to use the Pfizer vaccine in more counties, because we currently have more Pfizer first doses than Moderna first doses. And thankfully, just within the last few minutes, the federal government has allowed the Pfizer product to be used at lesser cold temperatures, and this should increase the ability of some of these counties to use the Pfizer product. So those two things together we think are going to help some of these counties. But in the interim, we're working to connect these counties with suppliers that could actually provide the cold storage facilities. So that's really good news on the Pfizer front. Other good news, the George Bush Monument. We're going to soon have a monument to Washington's first known black resident. And that's the George Bush tree that we'll have on our Capitol campus. As we know, Mr. Bush was born in Pennsylvania in the late 1700s. He settled in Missouri in 1844, came out on the Oregon Trail to Washington. His family arrived in Oregon. They encountered discriminatory exclusion laws that created a hostile environment for free black people. So they went north of the Columbia River and settled what is now Thurston County. Mr. Bush and others helped found modern-day Tumwater, and his role in the community was so restricted, if you remember this, when Congress excluded black people from owning land in 1850, Washington's territorial legislature successfully petitioned Congress to to let the Bush family retain ownership of their farm. And Bush's son, William Owen, was later elected as the first black legislator in Washington State. So our state's had a long history of trying to bend the arc of the moral universe forward. William Owen has been credited with helping establish Washington State University. So this monument is going to be located near the Bush butternut tree. And this was a tree that was cultivated from a tree that George Bush brought to Washington and planted in Tumwater. It's an amazing story of leadership and courage that I hope more people will be aware of when they visit our capital. I hope other folks are finding other ways to celebrate Black History Month, and there's a lot of ways to do that from our great story in the state of Washington. A word on current legislation. I'd like to address Senate Bill 5010. This is a joint request from myself and Insurance Commissioner Mike Kreidler. It sought to remove credit scores from the process of determining people's insurance rates that they pay. And that practice needed to stop and needs to stop because it is both unfair and discriminatory to people based on their color. The bill was ultimately, unfortunately, changed drastically. It's been watered down to the point where its impact would be quite minimal. The current version only prohibits the use of credit scores in determining increased rates over the next 3 years. And the use of someone's credit score in determining insurance rates and premiums we know is discriminatory. It should be outlawed, period. So I am requesting the legislature to revert the bill back to its appropriate, fair, and effective version as it was introduced, and I hope they will move in that direction. With that, I would be happy to stand for your questions.
First question comes from Rachel with AP.
Governor, you mentioned that details on phase 3 will come in the next several weeks as you talk to affected groups, but why hasn't there already been a general outline that could be refined during the process that you're talking about so that people and businesses can just have a sense of what to plan for, even if it's a bit down the road?
Well, because we need information to be able to do that in an effective way. We want to give people the truth. We want to give people as much predictability as we can provide them. We know how important that is to businesses and everyone else. But it would not serve their purpose to give them a plan that later didn't come to pass. So we need to do what we have done so successfully in this state, which is to look at the science of the variants that can be considerably more dangerous than the ones we've had experience with. We need to listen to business owners about what versions of their operations can be effective. We need to listen about what people have done already and how successful it has been. We need to listen to some other jurisdictions on things they've done. For instance, I got a call the other day from folks who are interested in pro sports. You know, can we open up more, maximum limits of people going to games? Well, we need to look at what people have done and what has worked. And that's going to take a period of time. So we're trying to be entirely transparent and honest with people, and we'll do that as soon as we possibly can. But I will tell you, I'm glad we're moving forward. That's the direction we're going.
Next question comes from Joe with the Seattle Times.
Governor, public health programs have suffered resource shortages for about 20 years now since the loss of MBET funding. The legislators have largely ignored those problems for the last 2 decades. And your budgets in recent years haven't put many more resources into those programs, and we've got a pandemic now where you have local public health jurisdictions short on the resources to help people out in low population regions. You've had the State Department of Health struggle on several fronts, including maintaining their data systems to manage the pandemic. Are you committed to signing a budget that provides substantial increases for public health, even if your proposal and other proposals for dedicated funding don't pass the legislature this year?
Yeah, I'm confident we're going to have increases for public health. One way or another, I'm confident that we will achieve that for obvious reasons.
Next question comes from Essex with Cairo 7.
Yes, Governor, you mentioned that it would take several weeks to continue evaluating the situation before phase 3. Right now, it's the end of February. Does that mean we will not reach phase 3 until at least the end of March?
Well, not necessarily. It could be earlier than that. If we get some very clarity on the variants, if we get further clarity on the ability of the vaccines to knock out the variants, that could happen before then. If we find a consensus across the state about how to have business openings under certain conditions, it could be before that. This has been a challenge for us, for the last year of not having all the information we'd like to have. But we generally have been making some, I believe, decisions that have been effective in saving lives and in rebuilding our economy, which we're doing now. And I think as long as we continue to hew to that course, we will have continued success.
Next question comes from Laurel with the Spokesman Review.
Hi, Governor. I'm wondering if the metrics and the data that you've been using, will that continue to be updated as you're reevaluating these phases and thinking about moving forward? And if not, can you or maybe Dr. Lindquist, who I believe is on the call, can explain that decision when maybe releasing some of these numbers more consistently might help restaurants and businesses have a better sense of where the region is going?
Well, the dashboards are remaining, all of this information is on our dashboard and it will continue to be on the dashboard. So I'm not sure which information you're referring to. Could you help me on that?
Yeah, just like the metrics that you use to move forward, they're normally not updated until every 2 weeks when you decide which regions are moving forward. Is that continuing to be the case? Will you be updating those metrics more regularly as you're trying to figure this out?
Well, we won't be updating things that are not relevant at the moment. No, there's not a reason for that. And until we evaluate the metrics, we won't have that. Scott, do you want to talk about what will be available?
Yeah, so we will continue to measure a lot of these updates. We won't report the report card every 2 weeks, but we will still have on the DOH dashboard many of the metrics that will be available for counties and business in particular and the public.
I would just, if I could chime in real quick, to emphasize Scott and the governor's point, our data dashboards that show the numbers of hospitalizations, the ICU occupancy in different areas in the state, the new daily case rates, all of those will continue to be available, and that's the data we're going to continue to use, and we hope the public continues to watch so that way we can see how COVID activity is happening in our communities.
Governor, last time you took the advice of the restaurants and opened up on Valentine's Day, they recommend you possibly changing phase 2 to include restaurants going up to 50%. Would you consider that advice?
Certainly. We will be talking to the restaurants. We will be looking at the variant science. We will be looking at the information that's coming in about the vaccines. We will be looking at the ability to have doses that we need. We're going to be looking at all those things, and certainly we'll be talking to the restaurants as well.
Next question comes from Sarah with McClatchy.
This question actually leads well into mine. I'm curious if you can get more specific about what the work will look like in the coming weeks as you design future phases. So if you could name, what groups you'll be meeting with, if there will be any sort of public engagement process, just as specific as you can get there.
Well, at 8 o'clock tomorrow morning, I will look at the epidemiological chart. I'll probably do that before I have my slice of toast. At 8:30, I'll call Nick and say, Nick, I'm pretty impressed with the information we got. What else are we doing? At 9 o'clock, I'll call Molly, and Molly will vector me in from a call that we just received from a county that had an issue. At 9:15, I'll call that county and say, is there any way we can help you out? At 9:30, I'll call Dr. Shaw, et cetera, et cetera, et cetera. I don't know how to specific to be. We will be talking to everybody that we can find on the planet Earth to help us answer these questions. The questions we will ask people are, what is the new science of the variants? What information do you have? We have some tremendous sources of information in Washington State about that. We have some of the best epidemiologists and geneticists in the world, literally. We talk to the Institute for Disease Modeling once a week. We had a good briefing from them yesterday, and we continually update that information. We will be talking to epidemiologists, including Scott, who does a great job, and some others from across the country who have more information about this. We will be reviewing on a daily basis the scientific information. And that when I say we, that includes me. I read some of the information that's coming in the New England Journal of Medicine or the Lancet or WHO, and I read that on a daily basis. Now that's kind of on the variants. I also look on a daily basis at the science about the efficaciousness of the vaccine against specific varieties. So on a daily basis, I look at the information that has come back about what percentage reduction in transmittability has been shown, for instance, in Scotland. So 2 days ago, I looked at the information from Scotland about how much transmission had been reduced with their particular vaccine, and it had tremendous result. It was extremely exciting. I did the same a few days before about the experience from Israel, and I looked at their efficaciousness. And when we look at efficaciousness, there's kind of two parts of that. One, how much does it reduce the transmission rates so that you can prevent the infection? But a second thing that I would argue even more important, how much does it reduce hospitalization and deaths? So we are intensely interested in that, in the effectiveness of these vaccines. And fortunately, very shortly, we believe we'll have 3 vaccines that are extremely effective in preventing hospitalizations and deaths. Then we will be looking at our vaccination program on a daily, if not hourly basis to try to make it more efficient. And when we do that, we talk to everybody in the state of Washington who possibly has a connection to that. Then we look at our business operations and what we can do to accommodate additional business activity, which involves talking to business people all over the state of Washington in multiple industries. We have several groups that advise us about this, of entrepreneurs, of the labor community. We look at the equity issues, and we talk to everyone in the state of Washington who we think can provide us information. How do we make this a more equitable effort? How do we get hard-served communities that have less access based on poverty or systemic racism or language barriers, and we try to figure out how do we make that system more effective. That involves talking to leaders, Black faith leaders, Hispanic leaders, Marshallese leaders, and that happens on a weekly basis at least. So I don't know how much detail you would like. It's pretty detailed exploration of what we'll be doing in the next upcoming weeks.
And if I can just build a little bit more on the governor's answer, a couple of the groups that we will certainly be talking to are the local health officers in each one of the counties to learn more about how the disease activity is shaping up in each of their communities and what they think are the appropriate next steps for us moving forward, considering the variants and the vaccine, as the governor mentioned. Also making sure that we check in and touch base with mayors, county commissioners, and other local elected officials so that way they have an opportunity to share from their perspective how the next steps going forward can consider all of the data that the governor mentioned and how we can move to the next steps in our reopening plan, in addition to all the members of the business community, the labor community, and other members of the public, so that way we can have a plan that is inclusive and considerate of everybody's feedback and input.
Hey, Governor, you already talked about this a little bit, but I want to ask specifically because I've heard a lot from parents. They're hopeful that you could take a look at football attendance. For instance, a volleyball team doesn't have as many people on the roster, you can have more people on the stands, but that's indoors. And we already have the science that says outdoors is safer and a stadium is more widespread. So do you think it would allow maybe parents to go see their kids play football? Is that something you'd consider?
Yeah, we're thinking about those issues. I just alluded to that. We're giving thought to what we could do on spectators at some of these athletic programs. So it is something we will be thinking about. and I'm hopeful we can make progress on it. Now we have to some degree because we've gone to phase 2, as you know. I know the Zags families are very happy about being able to see their incredible athletes playing, and we hope it's going to be in Indianapolis.
Next question comes from Jerry with the Everett Herald. Jerry, are you with us?
Hello, Governor. Earlier today, the state Supreme Court threw out a state law regarding the drug possession and essentially legalized possession of drugs in the state. I wondered what you can share from the Department of Corrections or others who have looked into that, and how many inmates could be released from correctional facilities as a result of this decision, and whether you support or want the legislature to bring you a law that would allow and restore a way for law enforcement to arrest someone for drug possession or not.
I just heard about this decision about 40 minutes ago, so I can't give you a lot of answers to those questions. I do think it's going to be something legislators will be interested in. And now that they've made this decision, there's probably ways to amend the decision to include a mens rea or a knowledge base into our statutes. And I'll be talking to legislators about that. So that's about what I can share with you right now. By the way, I just don't have any ideas now about the number of people that could be affected. I haven't had a chance to look at that yet. We'll get you that as soon as we can.
Next question comes from Jenny with KOIN. Jenny, are you there? Okay, we'll come back to Jenny in a second. Next, we'll go to Ashley with the South Seattle Emerald.
Hi, Governor. Your tone is a little bit more bullish on our progress on the pandemic than the Department of Health was this morning. Are you concerned at all that if things do take a turn for the worse, it'll hurt communities of color first? And what further safety steps will the state take to protect them with regards to their health and the safety net?
Yes. Well, look, we're concerned about everyone because every demographic group, obviously, we're concerned about, but people, communities of color have been had much disparate injury because of this pandemic. The Hispanic community is about 13% of the population, and I think they represent about 30% of the infections. The Black community has some disparities. I don't think it's that great between the portion of their demographics and the infection. So communities of color have had disproportionate infections as a result of this pandemic. So yes, we should all be concerned about that. The rate of fatalities has not been so disparate because of the age group, frankly, of some of these demographics. But the infection rate has been disparate, and that's something we should all be concerned about. On the equity issue, there are many things that we can do, and we are doing, to try to help get vaccinations to people who have had a reduction of health care or a disparate access to health care. And I've talked about some of these, but I'll just make mention to some of them. We have increased our allotment from about 13% to about 20% to community clinics, because community clinics serve large numbers of BIPOC communities. They're geographically more available, and they have good language services as well. So we've increased our allotment significantly to these community clinics. The federal government has also done that because they have also done a direct allocation to the community clinics. We have a very vigorous effort to provide communication and information to communities of color. It's about by the time we're done, it'll be about $15 million. And more importantly, it is using the trusted, credible messengers of these communities who are trusted to be able to organize their community and provide information to them. That's important generally just to know how to get access to vaccine, but it's also important because there is apparent greater reluctance to get the vaccine in some BIPOC communities because of the Tuskegee experiment and general lack in trust of government agencies. So that's an important aspect of this. We are also working to give people who are not quite as either computer literate or have access to get appointments. So at our mass vaccination sites, we are making sure that I think about 20% of the appointments are done just by phone. So it makes sure that people who work by phone rather than computer have some access to get these, these appointments that I know everybody's frustrated about. So those are some of the things we're doing. I know we can do more, and we're going to need to do more, and I'll tell you why. Because so far, our distribution has been relatively the same as the demographics. So the portion of the eligible population who are Hispanic is about 3.7%. And Hispanic folks have got about 2.7%. So it's very close to the dosages. So that's pretty close right now. But as we move to different phases and we have younger people, and it's a relatively young population of this community, we're going to have to increase the accessibility of the vaccine to this community. So what my point is, things might be looking relatively well at the moment, but we got to make sure we keep our eye on the ball on this. In the black community represents about 2.1% of the eligible population, and they've received about 2.7% of the vaccine. Again, that looks relatively fair, if you will, but going forward, we have to continue to increase our efforts. By the way, I should mention language barriers too. Language barriers are something we're very concerned about. We're doing our ad campaign in 32 languages, and we've engaged probably a couple dozen local organizations of multiple communities to be able to provide information to people.
Next question comes from Patrick with WNCA.
Yeah, hi, Governor. This is sort of alluding to something you said. What would you say to a Washington resident who isn't sure about taking the vaccine that you alluded to those existing?
Well, I would ask them what the nature of their concern is first, to be able to provide them information. In general, what I would say is that we have tried to provide the scientific information to citizens so they can make their own decision. And the scientific information we can give them is that these vaccines have been extensively, exquisitely tested in thousands of people in multiple demographics using the norms that we've always used, in a sense, to really evaluate these vaccines. And they have been done on a multiple levels. So not only in the federal level, but the state has also, we have our own virologists and epidemiologists that I have hired, if you will, to evaluate the information as well. It's not just the federal government. And frankly, we did that because there was some concerns about the last administration. So we have kind of two screens, if you will, to look at the information. And what that information has shown that is extremely compelling to me is that they are extremely effective. They're miracles. They're just miracles. I mean, they can save, maybe 8, 9 of the 10 deaths that we'd otherwise experience. That is an incredibly effective vaccine. So what I would say is they are certainly work and they are certainly safe. And if those are the two things people care about, I would share that information with people. Now, if people have specific concerns about it, I try to give them information so that they can make a decision on what's right for themselves.
We're going to go back and try Jenny with KOIM one more time. Jenny, are you there?
There is one other thing, if I can add, as far as people's reluctance. We can understand reluctance. These are new, but I think what's going to happen as the weeks and months go by, as people see their neighbors and their coworkers and their relatives getting the vaccination and having a good result and not getting sick and not having some adverse event, that's going to be the most compelling evidence for people. And I do believe as time goes on, the number of people who will be confident in the vaccine, I believe, is going to increase significantly as we see people around us having success with the vaccine. That's ultimately the most persuasive information that we humans work on.
Chair, I'm seeing that about 5.7% of our population are now vaccinated, and I'm wondering with possibly the Johnson & Johnson vaccine coming online, if that's going to change your estimate of when we could reach herd immunity, or when you think we might be able to reach that in Washington.
Well, it will be faster. We can be confident of that. I really don't have a precise enough, calendar to give you how much it will be faster. But they are significant productions. We will get potentially up to about 60,000 doses in the first week of the J&J vaccine. So that is not an insignificant amount to add. So what I can tell you is it will be faster, and I'm just thrilled by this because it is extremely effective in preventing hospitalization and death, and it's only one shot. So people don't have to have two shots, and the providers don't have to go through the logistics of making sure people get the second shot. So it has some advantages. So I'm really happy about that. By the way, I should mention this issue of herd immunity. One of the things I think we're going to find, I'm hopeful, you're seeing a pretty rapid reduction in some infection rates in Great Britain, and I believe Scotland, and Israel, that would suggest that you can start to reduce these transmission rates even before you reach absolute zero. So when we think, at least in my book, and I'm not an epidemiologist, and I'm certainly not a physician, but how I think about it is, it's not like you're, no herd immunity and the next morning you have herd immunity. It's a progression. And what I'm hopeful for, and I think there's good evidence of it, is it's going to reduce that transmission rate fairly dramatically. That is happening in other places. But again, I want to reiterate, because of these variants and the uncertainty that exists, this still is important. This still is our best line of defense, and I'm really hopeful people can continue to wear their masks.
Jenny was having technical difficulties, but we have her question. What are you all doing about vaccine allocation disparities? Data from Clark County Public Health shows that they're receiving significantly less vaccine per capita than other counties.
Yeah, well, first off, I've talked to the Department of Health, and they're trying to figure out a way to solve this problem. There's apparently a problem that the county didn't feel they were equipped to receive the Pfizer, as I understand it, vaccine, which required, up till now, a very cold chain storage system. And because people were not equipped to accept or would not accept that vaccine, this has been an issue. So we have tried to help the county by getting them more storage facilities, but because that was a problem for them, the state didn't have as many Pfizer available because we had to give some of the providers Moderna for the second dose because they'd use some of their dosages for their first doses. And obviously we had to get people doses so it didn't go to waste. So in long and short of it, as I think improvements are going to be made, there's an effort to try to be as fair as possible on this. And I think the department is attempting to do that in every way as possible. And I'm hoping this new news that we just got, that Pfizer apparently can now have a simpler supply chain, will also help Clark County and quite a number of other places.
Final question comes from Jesse with Cairo.
Yes, Senate Bill 5010. Question is does this bill in its current form hurt consumers, and what does it do, if passed in this form, what does it do to communities of color?
Well, I would say it doesn't do as much as it should by a long, long stretch of the imagination. This is a discriminatory, unfair practice. There is no reason it should be allowed in the state of Washington. And anything that's less than that is suboptimal. So we're urging the legislature to take another crack at this and bring this bill back to what the state needs, which is a strong stand against a discriminatory practice in this very important industry. And this is pure discrimination for a reason that is not legitimate in our state. So I'm speaking against it, and I hope they fix it. No, again, thank you. For everybody. Thanks for taking care of your health, and we will see you next week. Thank you.